Welcome back to Dolor Factor Live. Now, this is the time if you would like to call to speak to any of our guests tonight. If there's anything that has alarmed you, anything that you want to support, if you want to know more about the foundation, if you've been in a situation where you feel that you could have been helped and you wasn't, or maybe you were helped and you want to reinforce to people this kind of negativity that we're having, all these false assumptions. People assume, oh, so many things. This is the time that you can contact us. We have had a couple of emails and I'm going to go through some of them as we go along. But I would like to ask, because I have mentioned it before, people don't always understand the difference between a neurologist and a neurosurgeon. They don't even know that there is a difference. So can we clarify that, please? Dr. Penn?
Basically, these two are basically specialties that are related to the brain and basically the nervous system, and that's how you hear the name neurology, neurosurgery. But a neurologist is someone who deals with non-surgical neurological disorders, which a vast number of disorders, like Parkinson's disease, one of them. We have Huntington's disease. We do have a number of neurological disorders. So the neurologist is going to be dealing with such cases. The neurosurgeon is the one who deals with neurological disorders or problems that require surgery. Okay, so when you basically most cases are going to be within the brain itself, like brain tumors, like CVA, like cerebrovascular accident. I mean, we don't necessarily have to operate all of them. In some cases, you just have to let the patient, the brain heal itself. Okay, but any condition that requires surgery, that will be the neurosurgeon. And the neurologist is someone who is going to be dealing with all kinds of symptoms like numbness, not feeling some part of the body, things related to the nerves. Okay, so that is
so someone who is, say, suffering with diabetes, for example, sometimes if you've had or if you've had chemo, are these conditions that a neurologist would look at, like the numbness that chemo causes?
Well, I mean, the diabetes, in the case of diabetes, we will know exactly what is the cause of the neurological problem. You understand? So the internist will deal with the condition that led to the neurological problem. And if we can deal with that, most cases, well, either you prevent it or you can minimize the impact of the neurological problem. If it's necessary, then the internist may think, well, maybe I should get a neurologist involved, and that is still fine. But basically, you have one condition leading to the other. You have diabetes leading to neurological problem, which are the complications that result from it.
Okay, well, here's something here. An email. It's so sad to say, if we have one neurologist in St. Lucia, I would be very happy. I have been waiting since August 2013 so my daughter could see one. But what I know is we don't have one on island. We have a call, so I'm going to take that call and then I'm going to continue this. So thank you very much for calling Dolor Factor Live.
Good evening.
Good evening.
I have a daughter with hydrocephalus, and it is very difficult because, knowing that there is no neurologist in St. Lucia, if for some reason she has, because there's a tube inserted in her head, and it could get blocked at any time. But we do not have a neurologist in St. Lucia. So it is very fearful, So just listening to the program, it just brings everything home, more or less.
Okay, doctor, is there anything that you can...
Well, she said there's a tube inserted in the head. I want to ask her, did she have a surgery done? She had a surgery, right?
She had a surgery, but she did the surgery in the U.S.
Okay. Well, in this case, the follow-up will have to be a neurosurgeon, okay? Not a neurologist, right? But a neurosurgeon. Can you tell me a little bit about the problem she has? Does she have any problem with movement or
Well, she has spina bifida.
Okay.
And hydrocephalus.
Okay.
But then we take her to the U.S. every year. So she gets to see the neurosurgeon.
Okay.
And,
All right.
Well, she's not able to walk on her own. She walks assisted.
Okay. So in that case, I will think that they probably may have recommended that you saw a neurologist, right?
Mm-hmm.
Okay. I'm not really aware of neurologists in St. Lucia. I know we do have a neurosurgeon.
Yes,
But then, as we are on TV now, I mean, if there is a neurologist somewhere, definitely I will think that he will get in touch with Delia, and you can get that help. But I'm not aware of a neurologist, but a neurosurgeon.
Caller, can I just ask, how frustrated are you about this? How does it make you feel that you cannot get the proper care for your daughter in St. Lucia?
Well, like I said, it's fearful. I remember when she was younger, about 7 months, there was some swelling around her eyes, and we were not sure what it is. But then the fact that we know that she has hydrocephalus, we were not, sure what. So I asked the doctor whether she should do a CAT scan, because I didn't want to just sit around knowing that we do not have a neurologist in St. Lucia. And she told me she does not think it's, something that would require, but I needed to know. So I said, okay. She said, well, go ahead, do the CAT scan. After we did it, we had to send the images to the U.S. because the doctors here said they do not know what the pressure on the ventricle was. So they cannot say whether it has increased or not. So, it puts you in a situation where you are here with a child, but then you do not have the help if something were to go wrong. So after we sent the images to her doctor in the U.S., that was when, you put everything to rest because they tell you, it's nothing that you need to be too concerned about.
Okay.
Yes.
Okay.
Well, so basically what she said makes a lot of sense. So this is what we are here for. It's basically to have that kind of service that you need for your daughter. Okay, so if we have a neurosurgical unit and a neurosurgeon, I mean, he would follow up with your daughter, and you'll be more relaxed. So that's what we are trying to do right now.
And if there's any consolation, at least we have the first step now, and we are moving towards that and towards facilities that we know that we'll have the proper services for.
So, caller, thank you for calling, and maybe just keep your eyes and ears open for any developments, because maybe people like yourself who are experiencing this may be able to, I'm sure, to make valid contributions and to help them to get some support that will eventually, we hope, help your daughter and others like her. So thank you very much for calling.
You're welcome.
Thanks. It's just so horrible that you sit there helpless and, we can talk all we want to, we can act as much as we can, but we need that support. How can people help? I mean, these are human beings. These are people leading lives difficult lives, emotional lives, hard, especially when it comes to children. How can we help? Well, let's go back to the phone. Thank you for calling DBS. Hello.
Hi, good evening.
Good evening.
I'd like to find out from your guest, with the opening of the new St.Jude Hospital, what sort of measures will be put in place to have an effective management team for that hospital?
In fact, I can answer this because the process has already started. As I indicated before, that being a brand new hospital, we're not only looking at new facilities, but we are also looking at the training of staff, and that has started already. We have had the process going for about 2 years, and we have everything in place as far as the management is concerned. If you know St. Jude, you will see the whole face of the management team has changed, and we have some very, very positive persons as far as, and also some very good personnel as far as that is concerned, especially in the finance department. I can say that, because we have seen a lot of strides being done there, and hopefully we'll move forward with that. But I agree with you, management is the key. It's not just having new facilities, but having people well-trained that can move in and do what they're supposed to do.
Does that answer your question? Oh, the caller went. But thank you so much for the answer. Here's another statement here. I knew Teo, we worked together. I am still here at St. Jude's in the Department of Nursing. It was very sad what happened to him, and I was thrilled to hear that he had aspired to be a neurologist. Were either one of you aware of that?
Neurosurgeon, yeah, actually.
Oh, right.
I wasn't aware of that.
Yeah.
Ah.
So one of his classmates actually used to make fun of him, you know, they were very close, and she told me that story about Tayo, and she actually looked at him, the way he was dedicated, the way he goes about his studies and everything. He's very meticulous and very careful, you know, and that is what the neurosurgeon does, you know. You're dealing with the brain, very sensitive part of the body, and you know, so this was something that we all found out later on, that he was actually looking into that.
And he was one of our leading students, you have to say. Very much so. He used to,
very
you know,
good student,
very good
dedicated,
student.
Respectful,
always
in class.
Wow,
always
that's what I've been told.
Actually, I sent you more photos. I'm surprised you only have just a few of them.
Oh, I know you sent us a mountain of
yes,
photos.
a lot of photos. Yeah. Actually, I wanted to see more photos with him and his friends in the white coat and all of that.
Okay.
Yeah.
All right, let's go. We've missed the call. We're going to go to a break. When we come back, perhaps we can take the next call. Okay. It's going to be the last segment, so if you have anything to say, this is the time to do it. So stay with us on DBS. We'll see you shortly.